Caring for a seriously ill woman with suspected puerperal sepsis. In this video, I'll guide you through assessing a seriously ill postpartum woman with suspected puerperal sepsis using the Mills chart. Here's the equipment I need: a blood pressure cuff, stethoscope, tray containing thermometer, gallipot with swabs, a pulse oximeter, glucometer. Section 1. I obtain the woman's consent to begin assessment.
My name is Nosmiri. I'm here to examine you to find out what is wrong.
And if she is semi-conscious, I also seek consent from her family. I perform hand hygiene and wear appropriate PPE. This woman is potentially septic, so I follow infection prevention protocols. I start with the ABCDE assessment. This helps me identify life-threatening issues fast. I check her airway. Is the airway patent? I check her respiratory rate. 28. That's high. Her SpO2 is 90% on room air. For circulation, I check her heart rate and blood pressure. Her heart rate is 128 beats per minute. Blood pressure is 88 for systolic and 57 for diastolic. In the case of disability, it can be ascertained using the Glasgow Coma Scale or the Alert, Verbal, Pain or Unconscious Scale. The blood glucose level is also a pointer. I carry out the blood glucose level check. I perform a visual exam of the uterus, lochia, and perineum to check for signs of infection. Her temperature is 39.2 degrees Celsius. Her uterus is tender and sub-involuted. Lochia is offensive. These are signs of infection. Section 2. Now, I plot all observations on the Mills chart. I use the Mills chart to monitor and identify deterioration. Respiration 28. Red. SpO2 90%. Amber. Heart rate 128 beats per minute. Red. Blood pressure 88 for systolic, 57 diastolic. Red. Temperature 39.2 degrees Celsius. Red. AVPU. Patient's response to verbal communication. Red. Urine output. Unknown. Needs monitoring. With multiple red scores, this is a Mills triggering event. I need to escalate immediately as maternal sepsis progresses rapidly. Section 3. I call for urgent senior obstetric and medical review. She meets sepsis criteria. Hello, doc. We have an emergency for review. A 37-year-old Gravida 3 Para 3.
Delivered vaginally. No known complication. But now, not
I
in good
communicate
condition.
patient's condition using the S bar, which stands for situation, background, assessment, and recommendation. I then give the assessment to be suspected puerperal sepsis, high Mills, signs of shock. The recommendation will be urgent sepsis 6 bundle and transfer to high dependency unit. If the intensive care unit is not available, I prepare for transfer to higher level care early. I also ensure clear documentation and communicate with the family. Section 4. While awaiting help, I begin the sepsis 6 within 1 hour of recognition. Oxygen. I apply oxygen via a non-rebreather mask. Blood cultures. I collect blood cultures using a septic technique, if possible, before giving antibiotics. IV antibiotics. I administer IV antibiotics as per protocol. I use recommended broad spectrum antibiotics and follow the recommended protocol. Fluids. I set up wide bore IV access and start rapid fluid resuscitation. I give an initial bolus of 500 to 1000 ml of normal saline over 15 to 30 minutes. I check lactate if available. If not available, I use clinical signs of poor perfusion, capillary refill greater than 3 seconds, cold clammy skin, low blood pressure, or altered mental status. Urine output. I insert a catheter for monitoring. If no catheter is available, I record timed voiding using a clean container. Section 5. I document all findings on the meals chart and in the patient notes. I clearly record the time of the review request, interventions given, and the response. Having completed emergency interventions, patient is then changed into a more appropriate attire and transferred to the intensive care unit for further monitoring and interventions.